Good evening, everyone, and welcome to the Douglas County Board of Health regular meeting. Today is Thursday, November 10th, 2022. It is 5:03 p.m. Would you please all stand and join me in the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you to everyone here in the room and those online listening. The President, Doug Benevento, is just notified as he will not be able to be here today, but we do have a quorum, so we will go on with the meeting. Mr. Pratt, do we have attorney's certification for today's agenda?
Good evening, board members. Chris Pratt with the County Attorney's Office. All of the items on your agenda this evening have been reviewed by the County Attorney's Office and meet legal approval.
Thank you, Mr. Pratt. Do any of the members on the board have disclosures for any item on today's agenda?
No, ma'am.
No, ma'am.
No. And I do not either. Item number 2 is the consent agenda, and this would be approving the minutes of the Board of Health meeting from October 13th, 2022. I have a correction. Does anyone else have any corrections or suggestions about the minutes? Seeing no one, I did provide Bryn with the spelling. There was a woman who'd worked for the county for many years, and I just happen to know the complicated spelling of her last name, so Bryn has that for the correction. Other than that, I saw nothing else on those minutes, so do I have a motion to approve the minutes?
Move to approve the consent agenda.
Second, to approve the consent agenda.
Thank you. I have a first and a second. All in favor say aye.
Aye.
Aye, and that motion carries. Thank you, everyone. Moving on to the regular agenda, this is information items only. The first item is the Executive Director update. Mr. Hill.
Okay, thank you. So I'm just going to synopsize once again my written report. As has been going on for months, we continue to be hiring people. We've already hired a bunch of people who are going to start in January for WIC and health education and various programs where the funding doesn't kick in until January. We've also gotten a contract together with Stride Community Health to take over the clinical services part of the health department. That was approved by the commissioners financially on Tuesday, and we're just asking for the Board of Health to review it and make sure you're okay with the contract and vote on it tonight. I've done a fair amount of media in the last month, most of the questioning recently being about our budget and the differences between the level of financial support that our health department is asking for compared to the other two counties from Tri-County. A lot of interest by various reporters in that for whatever reason, I don't know. I just came back from the American Public Health Association annual meeting where I hung out with, when I wrote this, I thought there'd be 14,000 people there, but there were only 12,000, so it was a small conference this year. A lot of networking, a lot of interesting educational sessions. I sat on things ranging from opioids to homelessness to just a myriad of things. So once I get over my jet lag, I'm going to process all that and use it to enhance our efforts here. State funding amazingly continues to trickle in as different programs discover that they have funding that they should be giving to us. They're reaching out to me and offering. Most recently, I got $150,000 worth of immunization money that I didn't know was coming. And there's a few other little funding streams. So even though our budget was already in pretty good shape, it continues to get just a little bit better as the weeks go by. We're still working with the environmental health software vendor. I mean, the system is working. Caitlin's nodding her head. I hope, yeah, she's nodding her head that the system is working, but the promised ability for the public to be able to view the restaurant inspections is not yet working. When last I looked, is that still the case, Caitlin?
Would you like to come forward? Thank you, Caitlin. And if you could just give us your name, please.
I'm the Assistant Director for Environmental Health. We are still in the process of getting inspections up and running. There is currently one that you can view. They have turned on only body art so far, and they will be turning on restaurants and child care facilities very shortly. So it's in progress. It's just taking a little longer than we expected.
Thank you, Caitlin.
Thank you.
Thanks. So COVID-19 numbers in our community have been, the positivity rate of testing has gone up recently in the last few weeks, but the number of tests has kind of gone down. So I'm not sure what conclusions one can really draw from that. Our number of cases per 100,000 is up nudging 100 again. It was down in the 60s. So there's still some COVID bubbling in the background here. There is a respiratory syncytial virus, I guess you'd call it an outbreak, going on around the country. And we've had reporters asking me for numbers of cases in Douglas County, but that's a disease that's only reportable if you're hospitalized. So the only numbers we know are the numbers hospitalized. And I think that we're going to see from Rachel's presentation later in the agenda, she'll show us the actual right now data for what's going on in our community. And we're trying to do more to make that data accessible, so you don't have to call me and ask what's going on. You'll be able to go online and look. I know I've said that since I got here, but it's just taken a while to make the computers actually, meet the promises I'm trying to make. But we are getting there. Monkeypox outbreak, I'm going to stop talking about that because we never got higher than the less than or equal to 3 cases on the state's website, and that outbreak is petering out in the United States, it would appear. Future plans, we're working on filling the remaining positions. There's 2 or 3 positions I'm not even advertising yet because I don't have chairs for the people to sit in until we finalize taking over from Tri-County and move some of our staff to the Lone Tree facility to make room in Castle Rock, but we're closing in on it. Dashboards I mentioned in here, and that's before I wrote this before I asked Rachel to come and demonstrate some of the dashboards to us, so I think you'll like what you see there. And starting in January, now that we're in the formal budget system of the county, it's going to be easier for us to pull financial reports. So in the consent agenda, along with the minutes, you'll have a financial report each month for you to review and approve, just so that the Board of Health does have some visibility into the finances of the health department on an ongoing basis. And that's kind of my report. Happy to take questions if you got them.
Thank you, Mr. Hill. Any questions from the board for Mr. Hill? Okay, and then I see that we have reports that were submitted from Steve Montanez from the Administration Division, from John Surbeck from EPR and Division Surveillance Division, Caitlin Gappa from the Environmental Health Division, and also from Laura Larson with Community Health Division update. Do any board members have any questions for those individuals? Okay, no questions. I did read the reports. There was a lot of really good information in there. And what it tells me is that you all are doing a really good job with what we expect you to do and provide for us, so thank you. The next item is item F. This is a demonstration of the Douglas County Health Department website dashboards. Rachel Rock for staff.
Rachel Rock. I am the informatic epidemiologist on the communicable disease epidemiology side of the house. So I'd like to start by giving some context. So as a new health department, we have the opportunity to collect data, visualize it, and then share it with the public. So this is important for several reasons. The first being to maintain transparency and build situational awareness within our community. And another more important reason is to allow the community to make informed decisions for themselves and for their families. So the COVID dashboard has been up on our website since mid-August. It is a comprehensive view of the cases, hospitalizations, deaths, and vaccination rates in our county. What users are able to do is use the date range slicer and customize the view for the range of time that you would like to look at. So this first page is a summary of the last 30 days as well as of all time since March 2020 for cases, hospitalizations, and deaths. So I'm just going to click through this really quickly. Our hospitalization page shows cases by age group as well as reinfections. And same thing, if you use the slicer, you can customize your view over time. Deaths is very similar. For some reason, when I expanded out, I lost that slicer. So let me see if I can get back in. Nope. Okay. Sometimes on my laptop view that comes up, but it should be working on any other device, I promise. So for deaths, we have deaths by age group and deaths by race and ethnicity. This is one visual that takes a couple minutes to come up, but it's our cumulative count of vaccinated patients by date. So the amount of vaccinated people in our community. Below is some information about what it means to be up to date, which is currently recommended to have your primary series plus a booster, which is current CDC recommendation. So we'll give this a minute to pop up. There it is. Awesome. So recently we have about 158,000 people who are up to date with their vaccinations in the county. More information provides the public with links to our vaccine recommendations, a source to find vaccines near you, testing resources, as well as the CDC community level, which has been at low since about September. And finally, a page for methodology explaining where our data comes from. So the next report I'd like to share with you is the Communicable Disease Report. So the Communicable Disease Report is an overview of what the epidemiology team works on every day. This is reportable cases in Colorado, broken down by month for this year, and then in each specific category over the last 5 years. So, as we can see here in October, our respiratory incidence has shot up. So we've categorized each pathogen into enterics, respiratory, vector-borne pathogens, VPDs, waterborne pathogens, as well as influenza and RSV, which we will get to in just a second. So the influenza and RSV page, this is new as of this week. As Mr. Hill mentioned, all I have is data about hospitalizations in our county. As you can see in green is the RSV line, which has shot up in October. I plan on refreshing this data once a month, so on December 1st, I will have all of November's data to present. Finally, the Social Determinants of Health Dashboard, or the Community Overview, is a synopsis of the demographic makeup of our county. This is important because as a health department, we want to understand who we serve, where pockets of disparity exist, and how we can best address those issues. So this report is modeled after the CDC outline for the social determinants of health, which consist of economic stability, education, healthcare, the built environment, social context, and then I went ahead and added separate tabs for our Black, Indigenous, and person of color populations, as well as vulnerable populations. So this is an overview of the reports that are finished so far. In the future, I have plans to create projects for more detailed statistics on flu and RSV as that data becomes available, cancer incidents in our county, tobacco use, animal bites, as well as rabies, and diabetes and obesity. So really anything that has to do with our body of work, I want to be able to collect that data and share it with everyone. Thank you.
Thank you, Rachel. Does anyone have any questions for Rachel?
Nice job on the Power BI documents. I thought they were great. Will there be areas where it'll define, like how you're defining specific things, like how you're following your patients, or like diabetics, or?
In the future, for like a diabetes dashboard,
Yeah.
for example, that is on my radar, yes. I would like to do that.
Okay, nice. It's a nice presentation.
Thank you very much, Kim.
Anyone else? Rachel, let me just say that when I was looking through those, as you were going through those, I was impressed to see that you had data about veterans. Tomorrow is Veterans Day.
Yes, ma'am.
You had unhoused by the community they lived in. There is really a lot of good information on here. So if our listening public wants to get onto this, do they go to douglas.co.us and go to Public Health Department?
Correct. At the moment, the COVID dashboard is the only one living on our website. I plan to get the other reports once I tweak a couple of details up on our website at the beginning of next week.
Okay, thank you. Nicely done.
Thank you, ma'am.
We'll move on to the action item. This first and only item is a review and consideration of a contract with Stride Community Health Center. Mr. Hill, would you like to present this?
Sure. So originally we did an RFI or RFQ months ago before I even got here, looking for people to work with us on clinical services. That led to an RFP process, which we went through. The RFP process did not yield a successful bidder, so we were able to go out back to the people who responded to the RFI, one of whom was Stride Community Health Center. They are in a similar business to a health department clinic. They understood what we were looking for, and their proposal was much more reality-based, not just from a financial perspective, but just in general, what we're asking them to do for the people formerly served by Tri-County. It was just right on what we needed. And cheap guy that I am, the price was good too. So we spent some time going around with them. I think we have a good agreement. It's signed. It was approved financially by the commissioners on Tuesday. So I'm bringing it now to your board. That's kind of out of order, but just the way things were tracking, I'm trying to get this all in place by December 1st. So I kind of had to get it to the commissioners now, and a few days later to your board. I work for you. You can overturn this if you don't like it, but it is financially approved by the commissioners, and I think it's a good deal for the people in our county.
Thank you, Mr. Hill. Any questions from the board for Mr. Hill? Okay, I'm going to open this up for citizen comment then. Are there any citizens who would like to address the board on this particular topic? Seeing no one come forward, is there anyone online?
Thank you, Commissioner Thomas. I have no online comment.
Thank you, Troy. I'll close citizen comment and bring it back to the board to see if anyone is interested to make a motion to approve a contract for Stride Community Health Centers for an amount of $210,468 for 1 year starting January 1st, 22 through starting January 1st of 22 through December 31 of 23.
Move to approve contract with Stride.
Thank you, Commissioner Teal.
I second the motion.
Thank you. I have a first and a second. All in favor say aye.
Aye.
Aye. And that motion carries. We'll then move on to citizen comment. Are there any citizens who would like to address this board on any topic? Yes, ma'am, please come forward. Hi, Fran, how are you?
Thank you, and thank you for correcting my name. Good evening, board members. My name is Fran Santagata, S-A-N-T-A-G-A-T-A, from the Roxborough community, and I am just so excited to see this new dashboard up and running. Congratulations, what a great effort. I know that developing these dashboards is really, really a lot of work, but boy, oh boy, that gives us a ton of information as citizens in this county to be able to look at what's happening in the county and plan accordingly. So thank you for that, Rachel. I'm just so impressed. I love coming to these board meetings and hearing the good news. So the one thing I just wanted to mention today is more good news. Yesterday, the WHO reported a 90% drop in world COVID-19 deaths since February. That's phenomenal. And a lot of what was published, this was from CBS News, really tracks along with what Mr. Hill said. You know, they are very excited to publish the news, but also cautionary, because we know that it is difficult to get accurate numbers at this point because we're not seeing as much testing. But clearly the death rate has gone down dramatically from 75,000 in February of last year to a little bit under 10,000 this past week. So that is very, very hopeful. They have not, further on in the article, they have not, the WHO has not declared the pandemic over, because they're still seeing large pockets of outbreaks around the world, even though here in the United States we're seeing good control. So, I know that oftentimes gets people confused. Why is it still in place? It's because the pandemic is a global type of event. But here, in Douglas County, we're a reflection of the great measures that were taken early on and, continue to be taken on by not only the Board of Health, but also the citizens who are being prudent with what they do. So with that, I wanted to thank you for your time.
Thank you, Fran. Are there any other citizens who would like to address the board this evening? I don't see anyone in the hearing room coming forward. Troy, is there anyone else online?
I have no online comment.
Thank you.
I have one more thing before
great.
you adjourn.
I was going to bring it back to the board, or anybody else up here for any other comments?
So, and I meant to talk about this with Mr. Benevento, but he wasn't able to make it. I would like to, if it's okay with your board, cancel the December meeting, because I won't have any action items for you. And I'd also like to put before you that I think in January, I'm going to propose that we go to bi-monthly meetings, just because there's not enough action items to make me feel good about calling you all in here in the evening to spend your time. We're all happy to come and hang out with you if you want to have every month meetings, but I'm not sure the business is there anymore now that the health department is pretty much up and running. So that's a proposal I'll bring in January, but I'd like your permission to cancel the December meeting.
Thank you, Mr. Hill. Any comments to Mr. Hill's comment?
I guess really my only question is, would you like a formal motion on that, or would nodding head suffice?
I'm going to refer to my attorney here.
I don't think we need a formal motion on that. I think if there's general consensus, if there's no one who objects to that, I think we can coordinate that with the president and officially cancel that through our website. But just notice to anyone who may be listening and the public at large that that's probably coming. Sufficient here.
No objection here, Madam Vice President.
Thank you. Kim?
No objection at all.
I have no objections at all. We're not a bureaucracy that just needs to meet, so thank you. Before I close the meeting, do any board members have any comments they'd like to make?
No, ma'am.
No, ma'am.
Well, I'm going to just make a comment that our health department hosted an open house today. And most of us, I think all three of the commissioners were there, and I made a point to try and talk to every single person that I thought worked for the health department and have them hold up their name tags so I could try and remember their names. But I'll tell you what I found is that people were happy, they were laughing, and I asked every single one of them, how long have you been in this profession? How long have you, where have you worked before? And are you happy to be here? And every single person said, I am so delighted to be here. It is so fun to be able to build a brand new department from the floor up. And Mike, they all had good comments about you. And so, I just look back to that day it was July of 2020 when we had watched Tri-County Board of Health make a motion to mask us all up after Dr. Douglas had told us that was not going to happen. And that was the meeting. I watched that and I thought, it is time for Douglas County to have its own health department. And I made the motion the next day. It was seconded and passed. And here we are today. And I am just so thrilled to see this progress that you have all made. So thank you very much. And with that, I will close the meeting. I will wish everybody great holidays, and we'll see you all in 2023. Thank you, everyone.